Hi, my name is Christina Harris, and I'm doing a physical assessment for Health Assessment Nurse 612 at Maryville University. Before we started, I had Maggie empty her bladder and change into a patient gown. We took her height and weight and did her vitals, which were all within normal limits. We tested her vision with the Snellen chart and the Rosenbaum. Her vision was 20/20. And now we're going to begin with the assessment. So her face is symmetric, there's no lesions. I'm going to palpate it for any deformities. It all feels even. Face is warm. And okay, and then I'm going to test her cranial nerves. So first I'm going to have her clench her teeth. Okay, and then squeeze your eyes. Wrinkle your forehead. Puff your cheeks out. And stick your tongue out. Great, so her cranial nerves are all intact. And then we're going to move on to the eyes. So her eyelids are normal. Her eyelashes and eyebrows hair is evenly distributed. I'm going to palpate her lacrimal glands, which are normal. I'm going to test her pupillary response. Okay, just look straight ahead. Okay. Alright, and then I'm going to test the red reflex. Alright. Okay. And now I'm going to palpate her facial bones and her scalp. No obvious deformities. I'm going to feel her TMJ, so open your mouth, move your jaw side to side. Perfect, that all feels normal. And then I'm going to test your sensation. So tell me if you can feel this cotton ball on your forehead.
Yes.
And your cheek.
Yes.
And your chin.
Yes.
And then the other side.
Yes. Yes. Yes.
Okay. I'm also going to feel your sinuses and make sure there's no tenderness. Is that okay?
Mm-hmm.
Okay. Alright. And then her eye, her sclera are white. There's no redness. Her conjunctiva are just pink and normal looking. I'm going to have you cover one eye. Can you see normal?
Mm-hmm.
Okay, and then do it with the other one. Okay, perfect. Okay, and then follow my finger without moving your head. Okay. Alright, perfect. Okay, and now we're going to move on to the nose. So her nose is in the center of her face. Her septum straight. Any tenderness?
Mm-hmm.
Okay. I'm just going to look up. Okay. No swelling. Okay, I'm going to have you close your eyes and tell me what you smell.
Alcohol.
Okay, perfect. So smell is intact. Okay, and then we're going to move on to the ears. So I'm going to palpate. And she's got some earrings in, but they feel normal. I'm going to do the whisper test. So cover one ear for me, and I'm going to say a word, you tell me what I say.
Soccer.
Okay, and then the other ear?
Carrot.
Okay, perfect. So then I'm going to check for bone and air conduction with the tuning fork. So tell me when you can't hear this anymore.
Okay.
Okay, and then tell me when you can't feel it.
Okay.
Okay. And as it should be, the bone conduction is longer than the air conduction. Okay, again.
Okay. Okay.
Okay, perfect. And now I'm going to look at Maggie's tympanic membrane and ear canal. Okay. Okay. Alright. No wax, the tympanic membrane looks normal. Okay, and now I'm going to move on to the mouth. So her lips are normal, there's no lesions. Open your mouth. Her cheeks are pink and moist, gums are pink and moist. Her teeth look well taken care of. Stick your tongue out. Her tongue's symmetric, it moves evenly, it's pink and moist. And I'm going to look in your throat. So open up. see her tonsils, they're about a +1. The throat looks good. And she just said "ah" for me. And now I'm going to check gag reflex. So open up and say "ah" one more time. Okay. Okay, now I'm going to move on to the neck. So I'm going to feel for the lymph nodes. We've got submental, submandibular. We've got superior cervical, deep cervical, pre-auricular, and post-auricular, and occipital. Okay, and then I'm going to feel for her thyroid. It's midline in the trachea. And I'm going to have you swallow. Okay, perfect. I'm going to check the carotid pulses, one at a time. Okay, now I'm going to listen. Okay, great. Okay, and then I'm going to have you turn your head both ways and look up and down. Perfect. Now turn your head against my hand. Okay, and against my hand again. All right, shrug your shoulders. Okay, great. All right, and now I'm going to move on to your back. Okay, so the back is symmetric. Respirations are normal and unlabored. I'm going to test for tactile fremitus. So I'm going to have you say 99.
99, 99, 99, 99, 99.
Okay. And then I'm going to percuss. Okay. And lastly, I'm going to listen. Deep breath. One more. Okay. Okay. Now we're going to move to the anterior chest. So I'm going to test tactile fremitus again. Say 99.
99, 99, 99,
Okay. One more.
99.
Okay. And the chest appears symmetrical. Respirations are unlabored. There's no heaves or retractions. I'm going to percuss. Okay. I'm going to feel for the point of maximal impulse. Perfect. Okay, and then I'm going to check the axillary nodes and the infraclavicular nodes as well as the supraclavicular nodes. Okay, and now I'm going to listen again to all lung sounds. Okay. Okay, and I'm going to listen to the 5 heart sounds. Okay, so lung sounds are all clear. No murmurs. S1 and S2 are normal. Now I'm going to feel her arms. They're warm. There's no obvious deformities. There's some freckles. Skin color is normal. Check for pulses. Radial pulses. 2+. Brachial pulses. 2+ as well. Okay. Now I'm going to have you lay down and assess your abdomen. Okay. Alright. So the abdomen's symmetric. There's no obvious bulges. I'm just going to... The skin color is normal. I'm going to take a listen for vowel sounds in all areas. cardiac arteries and the femoral arteries. Okay. And now I'm going to percuss for the liver and the spleen. Okay, and feel for the liver under the ribs and the spleen. Any tenderness? Okay. Then I'm going to palpate, light, and then deep palpation. Any tenderness anywhere? Okay. I'll check for the right and left kidneys. Okay, and there's no aortic pulsations. Okay, and then I'm going to move on to the legs. So the skin color is normal, good cap refill, they're warm, hair is evenly distributed. I'm going to check pulses, so popliteal, 2+, 2+, dorsalis pedis, both of those are 2+, and then posttibial. Okay, now I'm going to have you sit up. I'm going to check your reflexes. First we'll do brachial. Okay, and then we'll do back here. Okay. Okay, I'm going to check your patellar. Okay, and your Achilles. Okay. Now I'm going to check for some strength. So lift up against my arm. Perfect. This one. Okay. Push down. All right. Pull back. Great. Okay. Now I'm going to have you stand up. And I'm going to have you do a squat. Okay. Perfect. And then bend over and touch your toes. All right. The spine is all intact. There's no bulges. It's all straight. All right. And that's the assessment. Thank you, Maggie.